My name is Julian Collinson. I'm a consultant cardiologist based mainly at Chelsea and Westminster Hospital, but also working at the Royal Brompton Hospital in London. I chose to specialise in cardiology when I was a junior doctor. I was working in very busy hospitals, and we were seeing dozens and dozens of people coming in with cardiac problems. So I chose to specialise in cardiology, first of all, because I thought there was a huge need, and secondly, because I thought there would never be a chance that I'd have a quiet life or be unemployed. So both of those things have worked out pretty well. It continues to be extremely busy, and well, technology's advanced a lot over the past 25, 30 years, which is when I first started in cardiology. And thankfully, we're now able to offer patients a lot more than we were in the 1990s. The most rewarding elements of my job are working with the patients. It's very much a partnership arrangement. In medicine, like in most areas of life, the answers to things are very rarely black and white. So talking to patients, finding out what they want, what their expectations are, and what expectations they have out of the treatments is very important. And I enjoy working with people a lot. I also enjoy working with the team because, again, like most areas in life, although, if you like, the cardiologist is the person who is the patient, the person the patient sees most often, you can't work without a team. And I'm very lucky in that virtually all the time the teams I work with are absolutely fantastic. And it's a very good reason to get out of bed in the morning, and they've certainly kept us going in the last couple of years when we've had COVID and very little else to enjoy. Patients value about me. I hope they value that I'm honest and I'm straightforward, and I work with them in partnership, and I tell them the truth about what's going on. I try and be very clear about their choices, and I do my best to support their choice. I try and help them understand if I think there's a particular right or wrong way of doing things, but I support their choices in whatever they do. What do I like about the patients? Well, I like the fact that they very often know exactly what they want, and then it becomes a more interesting negotiation. And I like the fact that sometimes we're very lucky in that we can actually make a profound difference to the way patients feel, and a difference to their outcomes, and help improve their lives. Well, so cardiology can be a very technical specialty, and there's a lot of gadgets that are used, but the main challenges are making the right decision for your patient. There's the technical elements, I think, are secondary. I think obviously one wants a good technician if one's going to have a procedure, but it's about making the decisions about what is right in that particular clinical situation that's the most challenging. And the doctors I most respect are those who can make a very clear and rational and careful decision, even under the most stressful situations. How do I behave when I'm frustrated and stressed? I'd have to ask my family that more than myself, but I'm very calm at work. I'm very measured at work. I try not to let myself, obviously there are moments when there is a lot of pressure on, and in those moments I sort of consciously can slow my heart down and focus on what's going on in front of me and compartmentalize those particular areas. I don't lose my temper at work. I don't shout at people. I'm very calm, and I work things through. And on those very rare occasions that something isn't going quite right, I'm not scared to ask for a bit of help or a bit of advice from somebody else, just to make sure that things are going the right way.